And you hear all the time about checking your skin, but what exactly are you looking for? And how do you tell the difference between, let's say, melanoma and a harmless mole? Let's bring in the expert here, Dr. Matthew Knight. He's the president of Knight Dermatology Institute. He is also a member of the Florida Board of Medicine. What other hats are you wearing? Speaking of hats.
Not this one today.
Okay. It's good to see you.
Thanks.
Thanks for being with us here this morning. I mean, this really is such an interesting topic because what are some general rules that you should look for?
Well, it's so important, especially here in Central Florida. The rate of melanoma is going up like 50% over the past decade. It's epidemic levels in terms of melanoma, and one person dies of melanoma in this country every hour, or maybe even every 30 minutes.
Really?
It's a lot of people. And there's been a lot of famous people, like Teddy Mellencamp, John Mellencamp's daughter, has stage 4 melanoma. Khloe Kardashian had melanoma. And so it's super important we talk about what to look for in terms of melanoma.
So before we get to the differences between melanoma and a mole, with melanoma, how do you know if that's what it is? Like if you're looking at it, you're going to say, okay, I'm not quite sure what I'm looking at here.
It's tough, and that's where we come into play. You know, professionals in dermatology look at this stuff all day long, day after day after day. And a lot of things, fortunately, people come in, they say, this is changing, and say, it's benign. It's no big deal.
I want to ask you real quick. So melanoma, let's say you catch it early. It's curable?
100%.
Okay, and that's the thing that's so distressing because there are people, as you said, who've passed away.
That's right. And, you know, Bob Marley died of melanoma at age 36. He didn't know he had a melanoma on his toe, but that's the way it happens. And so early detection really does save lives. If you catch a melanoma in its earliest phases, we call that stage 0 or in situ, it's almost always 100% curable. It's where it's let to grow where we have problems.
So let's get into now the difference between melanoma and, let's say, a common mole. I want to go ahead and show you an example here really quickly if I could. All right, so if you look on the left side there, right, what are we seeing right there?
So we try to teach folks the ABCDEs of melanoma detection, and this is trying to make it easy for folks to look in a hand mirror, have their spouse or a loved one look at their skin and say, that's a problem. On the left here, we are looking at what we call asymmetry. That's the A. So if it doesn't fold in half like one of those ink blot tests, that doesn't pass the test. So what we like are nice round little moles like on the right, not these jagged, weird moles that look weird on one side and not the other.
But Dr. Knight, how long does it take to get to the left? I mean,
you know, it really depends.
Right.
And that's the crazy thing about melanoma. It doesn't always read the book. And so the second one, we're looking at B, which is border irregularity. We want it to be nice and round like a fried egg. We don't want it to be jagged and misshapen around the edges, and that's B. And then C is color. You don't want weird colors in there like blue or red or white or other things. You could pretty much throw out diameter. I see a lot of large moles that are benign, but evolving moles, that's really the take home here.
Okay.
If you've got a mole on your body that is clearly changing and looking different, you got to go see a dermatology provider to look at it or do a biopsy where a pathologist can tell you what the heck is going on.
All right, speaking of doctor, let's get into this iris melanoma, which is something I have never heard of. What is that, and how do we know what we're looking at?
Yeah, it's hard. I mean, there's really only two places to get primary melanoma, your skin and your eyes.
I got you.
And that takes an eye doctor. They can look in the back of the eye, the retina of the eye,
and that's what we're looking at.
Right,
okay,
looking for
so
pigment.
describe what we're seeing here.
Well, you're seeing a lot of pigment that shouldn't be there, and that's the equivalent of having a funky mole on your skin would be a weird-looking mole on your eye, which can be melanoma. Unfortunately, there's a lot of vessels in your eyes, and so melanoma of the eye can be life-threatening for people.
All right, and to look at melanoma with a diameter change, let's check that one out as well, so that way we can give people a really good example of somebody who probably has this on their skin right now and has no idea.
That's right, and that's what happens, is say, oh, you know, I was just watching it and I finally decided to come in. It's really important that if you have weird moles or if you have fair skin or a family history of melanoma, or if you used tanning beds when you were younger or got blistering sunburns, go see a dermatology provider, get your skin checked, because something like this that's caught early, 100% curable. Something like this that's allowed to grow, say, oh, you know, I was watching it for a couple of years, can absolutely be life-threatening. And there's really not a lot of great treatment for melanoma once it spreads to distant organs.
So very quickly before we go, let's talk about prevention. I know that we have a hat that we can wear that could also help. Long sleeves if you're going to be out in the sun.
Long sleeves that cover you up. This is zinc oxide sunscreen, my favorite
zinc oxide,
as always.
make sure it's got the zinc oxide in there.
UV 400 sunglasses that are UVA and UVB, which cover the eyes. But again, melanoma is directly related to too much ultraviolet light when we're young. Tanning bed use, blistering sunburns. And so you can't stuff people in a time machine and go back to the 1980s to protect them from the sun. That's why it's so important to protect our youth, but do the best you can even now, right? It's not okay to be out in the sun all day here in Central Florida because a lot of us are not adapted to this environment. We're getting blasted with UV radiation that is a direct link to melanoma and other types of skin cancer. So be safe out there. Realize we're in Central Florida, which is the same latitude as like Cairo, Egypt.
Yes.
Get a ton of sun.
Right.
Take it seriously, right? Cover up, sunscreens, do your best. And if you're in any of those risk groups, go see a dermatology provider twice a year, just like going to the dentist. Get your moles checked. It's very unusual for somebody that goes into the dermatologist every 6 months to have a severe problem. Usually those things are caught early.
Really good information. Certainly people out there watching, I'm sure you've affected somebody who's like, I'm making the appointment right now.
That's awesome. Get skin checked.